Thank you, Axel, and hello, everybody. Let me start by expressing my deep appreciation to all colleagues for their extraordinary dedication and hard work under enormous pressure. COVID-19 has hit people and economies across South Asia. The region is also facing a series of disasters, including the strongest ever recorded cyclone, heat waves, locusts, violence, and conflicts, all of which make it much more difficult to fight coronavirus. Let me turn to Lynn for a regional update on COVID.
The pandemic hit South Asia later than other regions, but infection rates are now growing fast. Overcrowded cities and homes have made it easier for the virus to spread, and new cases are now increasing exponentially. As of this week, the region is quickly approaching 500,000 reported cases and nearly 11,000 deaths. Yet the numbers do not capture the full impact of COVID, as testing across South Asia is insufficient. Tragically, several colleagues in Bangladesh and other country offices have lost loved ones.
Besides the dire human toll, the pandemic has triggered an economic fallout across the region. Our estimates show that South Asia will likely experience its worst economic performance in the last 40 years. Growth is projected to contract by 2.7% in 2020. The pandemic will increase poverty and worsen inequality. South Asia may very well see the largest increase in the number of poor as a result of COVID-19. Low-income people, especially informal workers, are at risk as they lack access to healthcare and are more likely to have lost their job. To date, we have committed more than $3.2 billion. More than half of this, $1.6 billion, is already disbursed. This support has helped governments buy vital protective equipment and medical supplies for frontline workers, provide learning to children, and deliver cash transfers and food to the most vulnerable.
In India alone, we have provided $2 billion to support healthcare and to strengthen social protection for the poorest and the most vulnerable, especially women and migrant workers. In Pakistan, we helped the government expand its national safety net, the Benazir Income Support Program. 4.5 million existing beneficiaries received an increase in transfers, and 7.5 million new beneficiaries received a one-time transfer to help with COVID-related issues. We also launched Teleschool on Pakistani television, so young students can continue learning remotely while their schools are closed. In Afghanistan, health workers in our projects are teaching villagers to use masks, as well as to follow social distancing rules and other medical guidelines.
We are now ramping up our investment. By the end of this fiscal year, we aim to deliver close to $3 billion. This additional support will help South Asian governments revive economies, jumpstart businesses, create jobs, and protect their people. Together, we can overcome the worst impacts of the pandemic and build back better.